Tablets and spoonfuls. How to manage your body. Taking medication while at home. Correctly taking your meds will help your syndrome. Tablets and spoonfuls hosted by Quick Care Pharmacy.
Okay, ladies and gentlemen, welcome once again to another program, Tablets and Spoonfuls, on your radio. Call in. All our listeners gather around. It's that time again when we meet with you and we share with you, Mafra. Good morning. It's good to be back on Tablets and Spoonfuls.
Yes, it's good to be back. Good morning to you, Felix. You sound very excited on being on Tablets and Spoonfuls
As
today.
usual, yeah.
Yes, let's say thank you, Father, for another opportunity. And we want to say welcome and good morning to all our many tuned in favorite listeners and to all the
Yeah.
newcomers tuning in today and hearing on Tablets and Spoonfuls. We do hope that you enjoy as we move forward in our discussion.
Yes, and we always remind people that what is our objective. That is to help you to manage your medication at home properly. It has to be managed, or else you can make a boo-boo, you can make a mess of it all.
That is true. That is very true. So we're happy on Tablets and Spoonful to continue assisting you on how to best do that at home.
Yes, and so many topics we've covered. If there's something that you'd probably like us to look at, you can probably tell us why not. The number to call, any questions, any issues, call 440-8600. Quick Care Pharmacy, of course. Tablets and Spoonful is a production of Quick Care Pharmacy. Let me tell you what's happening at Quick Care Pharmacy. I'm sure you remember, some of you remember our promotion. If you come to Quick Care with your prescription and you service your prescription at Quick Care Pharmacy, of course, your name goes into a box or a barrel. I don't know exactly what my has a box. A barrel.
A barrel.
All right. Your name goes in there. And at the end of the month, 2 names will be pulled out. Hopefully it's your name. And of course, that person will get $100 to go towards your next doctor's appointment. Sometimes it can be so difficult. You want to go to the doctor, but but 2 people will get $100 each towards your next doctor's appointment when you fill your prescription at Quick Care Pharmacy, and that raffle is drawn. All right, Martha?
That's right.
So we have some people in the box, I'm sure.
Well, actually, Felix, it begins as of the 1st of April.
Oh, from the 1st of April, of course.
Yes.
And this is not Poisson Avenue. This is real can be.
As real as can be. We want to encourage our customers to keep seeing your doctor, get their reviews, whether they need to be changes, additions, subtractions. That's very important. So at Quick Care recognize the need, and so we thought one of the ways we can give back is, like Felix said, at the end of the month, 2 individuals will win out of a draw $100 towards their next doctor's visit.
Right, and like we said, that's a production of Quick Care Pharmacy. Let's get an ad now from Quick Care Pharmacy. Okay, ladies and gentlemen, welcome once again to Tablets and Spoonfuls on your radio. And on today's program, we will, of course, look at something new, and that is Mafa.
Yes, a very common, very, very common question. Why are you taking so long to fill my prescription?
I can hear somebody's asking that question.
Yes. And it's not asked only to me. It's a universal thing, actually.
For pharmacists.
Yes. So somebody might start off by saying, I can see the medicine behind you. It's like 2 meters away. So just grab it off the shelf and press on the old sticker. Slap it on anyway, and let's be on our way. Is there some kind of magical process that's taking place back there? Because I'm very intrigued as to why it takes so long. I mean, how much time does it honestly take to count 30 pills into a bottle and label it? It should just take a few minutes, right? So this is a very, 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 very common question.
Well, the difference is that it's not tablet cocoa.
That's right.
Coconut cheese.
That's a good one. That's a good one. So
This is medication.
that is
That
right.
could be life and death.
And we will see that as we go.
Oh, yeah.
So no customer likes to wait, but the wait for a prescription to be dispensed is often inevitable and extremely critical. In the pharmacy profession, it has been shown that there's a clear correlation between people saying, I think I waited too long, and their overall perception of the service. So I've waited too long, I don't even care really, because as far as I'm concerned, I stayed there too long to get my
As far as the concerned, as poor service.
Yes. So apparently, if customers wait too long, they tend to mark down the other aspects of the service, like patient counseling, which is very important. Because after you've dispensed a prescription, giving you the medication and just sending you off is just as bad as making an error. So it's unfortunate that the patient will want to mark down the service offered within the pharmacy to you based on your prescription.
Don't you think, Martha, it's because, not that you are trying to look down or bring down the old-time pharmacists, but it's because there was a tradition before where not only pharmacists but doctors, people didn't ask questions, people didn't talk much to patients. It's like they hand the money and the ticket. It's like you go to the doctor or you go to the pharmacist and they give you your medication, and whatever they give you, it's any boy.
Well, the thing is, there is a new advent in
things
pharmacy.
change.
Things
Yeah.
has changed, and during you used the word old time pharmacy. That was what we call the apprenticeship system. So it was more basically a trial and error kind of thing. Most of these apprentices never really studied drugs per se, but they were familiar with a certain number of drugs that was very commonly used, only ones used.
Yeah, and
So it
there
was
many
easy.
drugs used in
Yes.
those days.
So it was easy to
For
just
infections. You had penicillin.
right.
You had for so it was.
It was easier to speak. It was easier to just give and don't talk much about it. But now we have so many different drugs, hundreds and hundreds and hundreds of drugs. We have drug interactions, drug contraindications, and so it is
drug
important.
interactions, would be, of course, how it affects, or one drug affects the other drug.
Is affected by
in
the
your
other
body,
drug.
in your
Yes.
system.
Yes.
And the other one you spoke about is
The drug contraindication, whether this drug is good or not for the diagnosis or to the individual, because you might be allergic to.
right. Maybe good for one person, not good for you.
Right. So, as an experienced pharmacist with work experience in many community pharmacies, a pharmacy that which the community pharmacy is a pharmacy that allows the public to their medication, unlike, for example, the hospital pharmacy setting. Okay. So, as an experienced pharmacist, I want to shed some light on why it may take an exceptional amount of time to fill your prescription.
Well, let's go ahead. That's the main question for today.
That's right. So the process of medication dispensing is more complex than it actually looks. Specific requirements must be abided by as described in the Pharmacy Regulation Act. We do have an act.
Governs a pharmacy.
That is
So it's
very
not
true.
as simple as
It is not
looks.
as simple as it looks. So more often than not, the pharmacy will be the patient's last stop from the doctor's visit. Sometimes the patients may be running with the occasional thin temper flares among them when the pharmacists are perceived to be dragging their feet in the prescription filling.
Because invariably they stay so long at
At the doctor's office, and now the pharmacist here
mhm.
is keeping me
Sometimes
behind.
you hear about an appointment. Your appointment is 10:30, and you leave at 2:00, and you have things to do, deadlines to meet.
That's
and
right.
Here comes this pharmacist cap on time.
So it is not difficult to understand the sentiments among the people, given the long wait they have already endured, before seeing a doctor. This can be very uncomfortable, particularly when a patient is already unwell to begin with. It is with a little surprise that the pharmacists filling their prescriptions are often being viewed as the person standing between them and their much anticipated freedom. I want to go. After all, how hard could it be to just get those medicines off the shelf and dispense them? Only when every uncertainty is resolved can the pharmacist proceed with label printing, filling of prescription, and medicine dispensing with concurrent counseling. That is what one of the major roles of the pharmacist, especially in a retail or community pharmacy.
Because you will see the directions on the bottle. It doesn't just appear abracadabra. It's got to be typed.
Okay, I will be telling you something about that. That's right. So your pharmacist has a really vital role in essentially preventing the doctors from making mistakes. Like a saying we hear, to be err is to be human. To err is to be human. This and so doctors, pharmacists, nurses, we are not immune. And this can have their consequences. Okay?
So you think, Martha, because you're a pharmacist and because somebody's a doctor, that they can't
make mistakes. We can,
but
because we're human.
Not only mistake, but Mr. Tick,
deadly.
Mrs. Tick, Madam Tick. Deadly ticks.
That is true.
You got to be constantly aware of what you're doing, constantly focused.
Focused.
That's why I always say, do not disturb
your pharmacist and do not rush your pharmacist. It's very, very important. So your pharmacist do the double checking for things such as medication interactions and allergies that can be missed, and of course, kill.
The doctor might just give you that medication. And he has so many patients to look at. He may not have thought of that.
No, and then I've seen situations where the doctor know that the patient is allergic to the medication, but still wrote. The doctor made a note on the patient's book that the child is allergic to that particular category of drugs. But however, the doctor still wrote that prescription with that particular drug for the patient. So when you get the prescription, if it's a book, sometimes you have to read the content of the book in order to help you complete the prescription filling. So they think really
confusing.
Exactly. So right away I had to pick up the phone and call the doctor and let the doctor know that the patient is allergic to that, but you wrote that, and the doctor's like, oh shoot, and we had to make the changes. Okay, so regardless if the medicines are just right behind us on the shelf or not, it is really unfair and an ignorant view to have about what is done in the pharmacy.
Oh, so like we said, it's not as simple as it seems.
It is not as simple as it is.
There's a lot going on in there, like we said, you got to type it, you got to make sure it doesn't affect the other medications you're taking, or just the simple case we spoke about a while ago, so all that goes into play.
Yes, definitely. So so here are some ABCs, we call them, of a pharmacist. It is not like one person who I recently met say, and this was really like, wow, are you really serious? Would express themselves and say, the reason we take so long is because we don't know what we are doing. That is a really ignorant and unfair view to have about a pharmacist.
So if you don't know what you're doing there then?
Yes, what are you doing there? And then another one I've heard is that this pharmacist is just slow.
So that's why they say do not disturb the pharmacist.
But it is important to note that every step needs to be meticulously carried out to ensure that every patient will receive only the correct medication at the right dose for the diagnosis condition while avoiding potential drug interactions. After all, an error at any stage may undo both the doctor's hard work of the disease diagnosis as well as a patient's long, exhausting effort of trying to recover. If you make an error, it makes no sense. You're right. Therefore,
the square one or even worse.
Exactly. So therefore, the next time you experience a delay in getting your medication dispensed, do remember that the pharmacist is hard at work to ensure that you will leave the pharmacy with medications that are suitable, safe, and effective for the intended treatment only for you. So it's all about you.
Yeah, that it's in your